నమస్కారం, హెల్త్ కేర్ కార్యక్రమానికి స్వాగతం. అసలు సడన్ కార్డియాక్ డెత్ అంటే ఏమిటి, ఇది రాకుండా ఉండాలంటే ఎలాంటి జాగ్రత్తలు తీసుకోవాలి, ప్రస్తుతం దీనికి సంబంధించి ఎలాంటి చికిత్సా విధానాలు అందుబాటులో ఉన్నాయి మనకు తెలియజేయడానికి అమోర్ హాస్పిటల్ నుండి డాక్టర్ ఇమ్రాన్ ఉల్-హక్ గారు ఉన్నారు, కన్సల్టెంట్ కార్డియాలజిస్ట్. వారిని అడిగి మరిన్ని విషయాలు తెలుసుకుందాం. నమస్తే అండి.
నమస్కారం
సార్, అసలు కార్డియాక్ డెత్ అంటే ఏంటి?
There are two terms actually. One is sudden cardiac death and sudden cardiac arrest. Both are quite different. Sudden cardiac arrest ante there is a complete cessation of cardiac activity. Ante your heart just stops beating, and that is when a person gets arrested, we say. That is called sudden cardiac arrest. Okay, sudden cardiac death is death due to cardiac arrest, you can say. Once the person lands up in cardiac arrest, and if he is not sufficiently revived, he will land up in sudden cardiac death. Okay. So ideally, by definition, sudden cardiac death ante once the onset of symptoms are there within 1 hour, if the patient dies, that usually is classified as sudden cardiac death.
అలాగే సడన్ కార్డియాక్ డెత్ వచ్చే ముందు ఎలాంటి లక్షణాలు ఉంటాయి, శరీరంలో ఎలాంటి లక్షణాలు అవుతాయి?
See, sudden cardiac death is a sudden event obviously, so there are some symptoms which the patient can experience before developing a cardiac arrest. Okay, so the most common reason for sudden cardiac arrest is obviously heart attack. Okay, heart attack. So your heart requires blood supply that is supplied through vessels which are called as coronary arteries. So when there is a block in these arteries, a person develops heart attack. So when the sudden cardiac arrest is because of heart attack, person can experience chest pain, breathing problem, okay, occasionally giddiness and all. Okay, these are the classical symptoms of sudden cardiac arrest if it is because of heart attack. Sudden cardiac arrest also can be because of many other causes. Okay, in those cases usually a person will not have a chest pain. What they have is sometimes they develop giddiness, or it is called as near syncope. They develop giddiness and suddenly they fall down. That is one of the symptoms. Sometimes they have some uneasiness, breathlessness, sweating. Okay, these are some of the warning symptoms which precedes a sudden cardiac arrest. Okay, not all giddiness, not all sweating is because of cardiac arrest. That one differentiation has to be there. Yeah.
సడన్ కార్డియాక్ అరెస్ట్ కి కాజెస్ ఏ విధంగా ఉంటాయి?
Yeah, see, your heart has got different structures in it. One is the heart muscle itself, then there are chambers, atria, ventricle, heart walls, and blood supply to the heart. So diseases affecting different part of the heart can manifest as cardiac arrest. Suppose if the disease affect the blood vessels in the heart, that is called as heart attack. So the most common cause of sudden cardiac arrest, as already told, is a heart attack. So any blockages in the heart that can cause sudden cardiac, in fact it's about 75% of the cases of sudden cardiac arrest, especially in elderly people, is because of heart attack. Okay, there are some other diseases which affect different parts of the heart, like your heart muscle can get affected with certain diseases. These are genetic diseases. There are diseases such as hypertrophic cardiomyopathy. Okay, there are other diseases also, that is called as different types of cardiomyopathy, infiltrative cardiomyopathy, restrictive cardiomyopathy. Any disease which affect the heart muscle, that also can cause sudden cardiac arrest. There are some diseases which affect the rhythm of the heart. Like normally your heart rate is between 60 to 100 beats per minute. So there are diseases which affect your heart rate. Those can cause a sudden rise or a sudden fall in the heart rate. That also can cause sudden cardiac arrest. Okay, there are diseases like what we say as Brugada syndrome, reporation syndrome, VT, ventricular tachycardia, ventricular fibrillation, all idiopathic causes. There are a lot of causes. All this means there is a rhythm disturbance in the heart where the heart rate suddenly goes to 200, 300 beats per minute, or in case of heart blocks 30, 20 beats per minute. All these different diseases can cause cardiac arrest. And also there are diseases which affect the heart walls. Okay, like your aortic stenosis, and the main wall which is supplying blood to various organs get diseased and get narrowed, person can experience sudden cardiac arrest. Okay, there are some other diseases also which affect the large vessels in the heart, like your aorta. If aortic dissection is there, that also causes sudden cardiac arrest. So these are some of the causes of cardiac arrest. There is a difference between the age of presentation in these causes. Suppose you see an elderly person more than 40 years, 50 years having sudden cardiac arrest, the probability of cause in that person is likely ischemic, or it is because of a heart attack. Nowadays we see a lot of young people having sudden cardiac arrest. Okay, that in that case it is not the heart attack which is causing the cardiac arrest. It is either of these genetic abnormalities which are not detected, they are causing the cardiac arrest in these patients. So labeling all people who die in young age because of sudden death due to cardiac arrest is correct, but not due to heart attacks. Okay, there is a difference. Heart attack is different and sudden cardiac arrest is different. Heart attack usually we say when the arrest is because of blockages in the heart vessels. So diseases which affect the heart musculature or the rhythm, they are classified as sudden cardiac arrest but not heart attacks.
ఇందాక మీరు అన్నట్టు యంగ్ పీపుల్ కూడా సడన్ కార్డియాక్ అరెస్ట్తో చాలామంది బాధపడుతున్నారు. సో మరి ఎలాంటి టెస్టులు చేయించుకోవాలంటారు? ఇందాక మీరు సిమ్టమ్స్ చెప్పారు ఏ విధంగా ఉంటాయో, సో ఎటువంటి టెస్టులు చేయించుకోవాలి?
Yes, see, routinely not all young people require cardiac testing, okay, but there are some risk factors which has to be identified. So these risk factors include any family history of sudden cardiac death. This is a very important risk factor. So మీరు ఇంట్లో your relatives, your brothers, your anyone, your sisters, if they have died of cardiac cause prematurely, less than 40 years, and they die suddenly, then you come under a risk category. So in that case you need to get evaluated. That is one thing. And another thing is, suppose you as a person, as a patient, you have experienced any chest pain or a near syncope, that you have suddenly fall down somewhere in the past. You had extreme, you feel like your heart is beating too fast and suddenly you had a fall down or a syncope. In that case you need to get evaluated. So not all people, young people needs to have cardiac evaluation, only these risk category people has to be evaluated. So what test has to be done in these patients is a routine ECG. By doing a routine ECG, we will come to know if there are any rhythm disturbances, okay, where there is any genetic cause which is causing sudden cardiac arrest in these people. Another thing is a 2D echo. 2D echo is a simple test by which we will come to know if there is any disease in the heart muscles which is causing the cardiac arrest, or a disease in the walls which is causing this problem. So these two are quite simple tests, ECG and 2D echo. Based on these tests, further testings are there, like electrophysiological studies are there to detect genetic disease. There are genetic testing to detect these genetic disorders. So depending on your initial test, you may require further testings.
సార్ అలాగే సడన్ కార్డియాక్ డెత్ రాకుండా ఉండాలంటే ఎలాంటి జాగ్రత్తలు తీసుకోవాలి?
Yeah, so see, precautions when you have experienced these symptoms, go to the doctor and get investigations done. Okay, so at least your risk stratification will be there. So you will come to know your risk of having cardiac arrest. Okay, if your risk is low and your ECG today echo are normal, that unlikely you will experience a cardiac arrest. But if you have any of these risk factors, then periodic screening will be required for you. Regular checkups you have to do. Every 6 months you have to get investigations done, so as to detect any abnormalities. There are some other tests which you need to undergo to detect any fatal conditions also. Okay, that depends according to the history and according to the presentations which we get on investigations.
సార్ అలాగే ఇందాక యంగ్ పీపుల్కి అలాగే 40 years అబోవ్ వాళ్ళకి వస్తుంది అంటున్నారు కదా, 40 years అబోవ్ ఉన్న వాళ్ళు ఎలాంటి టెస్టులు చేయించుకోవాలి?
See, the most common reason for cardiac arrest in aged people, as I told, is heart attack basically. So in these patients, you have to do regular screening, at least yearly blood test and other cardiac screening has to be done. They say once you cross 35 years, your yearly sugar and cholesterol test has to be done as a routine. Okay, when you have these risk factors, there are some special investigations to detect your risk of developing heart attacks. So these tests include, as I told already, routine ECG and 2D echo, but these are not 100% conclusive of heart disease. So you need some non-invasive tests like a treadmill test. Treadmill test is, we ask the person to walk on treadmill and we record continuously his ECG. So this is like an indirect test to detect heart blockages.
Okay.
So if the person has heart blockages, on treadmill we will get changes. So by that we will come to know that the person requires further investigation, including in the form of a coronary angiogram. Okay. Angiogram is like the gold standard for detecting heart blockages. Okay. But not all people with risk factors require angiogram. Only if they have some symptoms, or if your treadmill shows some positive changes, then probably you will require an angiogram. So any person who has crossed 40 years or something, he requires routine blood investigations, and if you want to specially screen for cardiac disease, at least an ECG, 2D echo, treadmill test are required. So depending on these tests, your further testing may be required for these type of patients.
సార్ అలాగే ఇప్పుడు ఏజ్తో సంబంధం లేకుండా హార్ట్ అటాక్స్ అనేవి చాలా మందికి వస్తున్నాయి. సో హార్ట్ అటాక్ అనేది ఎందుకు వస్తుంది, అసలు రీజన్ ఏంటి?
Yeah. See, the reason for heart attack is multifactorial. Multifactorial అంటే దే ఒకటే సింగిల్ ఫ్యాక్టర్ కాదు, దే ఆర్ లాట్ ఆఫ్ ఫ్యాక్టర్స్ విచ్ కెన్ కాజ్ హార్ట్ అటాక్. సో it basically heart attack means development of blockages in the heart vessel that develops over a period of time. It is not just 1 or 2 days a person develop blocks and he develop heart. It is not like that. These blocks starts developing over a long period of time, years together. So there are many risk factors for heart attack. The most common being your diabetes, hypertension, okay, or cholesterol. These are some of the causes which you can detect, and there are some other causes also like cigarette smoking, tobacco consumption, alcohol consumption, okay. So all these are risk factors which can lead to heart attack for a long period of time. We see many people, if they don't do test, suddenly once they get their test done and sugars are very high, blood pressures are very high. So why? Because most of these diseases usually are asymptomatic. Your high blood pressure will not cause you much symptoms, okay. That's why it is called as a silent killer, okay. That's the reason these diseases has to be like screened. Before you develop these diseases, it is better to screen for them, okay. So how it will be, a sugar, a patient, if you see 1 year, 2 year, he may not have much problem, but uncontrolled sugar for a prolonged period of time, 5 years, 10 years, sugars are not controlled, it causes significant damage in the body. It leads to blockages in the heart, in the brain, it damages your kidney. So a sugar patients will have very worse blockages in all the blood vessels of the body. So sugar patients will have increased risk of developing heart attack, okay, if it is not controlled. Similar is the case with hypertension. Nowadays we see many people, their sugars are like 300, 400. They say we don't have symptoms, though they are least bothered. So they may be fine at that particular time, but over a period of years they will develop significant damage. So whenever you have sugar, you have blood pressure, you need to strictly control them so as that your future life will be good and you will prevent the development of heart attack. All this requires your regular follow-up, regular investigations, so as to assess that these risk factors are well under control.
అలాగే సార్ ఇందాక సడన్ కార్డియాక్ డెత్ ఎటువంటి వారిలో వచ్చే అవకాశం ఉంది, అంటే ఈ లక్షణాలు ఉన్న వారిలో ప్రధానంగా వస్తుంది అని ఉంటుంది కదా, ఎటువంటి వారిలో వచ్చే అవకాశం ఉంది?
See, this need not always they have symptoms for sudden cardiac arrest. As I told, it is just sudden cardiac arrest by definition is just within 1 hour of symptom onset. So how it manifests, I'll give an example. A person may be having uncontrolled sugar, uncontrolled blood pressure, he may not have done any investigations. So such people, suddenly he does some activity, like he recently he will go to gym, he does some heavy exertion, and you know what is the status of cardiac is not known for these people. So once he does sudden activity, he will end up in heart attack, because he has risk factors which has not been controlled, his body is not used to exercise, and he has done over exertion. So these causes, already he will be having some blocks in the heart. When he does sudden exertion, these blocks get ruptured, and that is when a person lands up in heart attack. So always, that need not always be that a person has some symptoms. If risk factors are not controlled, a sudden severe exertion itself can land up in heart attack.
సార్ అలాగే మనం సడన్గా రోడ్పై వెళ్తూ ఉంటే ఎదురుగా అతనికి సడన్ కార్డియాక్ అరెస్ట్ వస్తే మనం ఏ విధంగా చేయాలి అతను?
See, first is to know that he is having sudden cardiac arrest, okay. How will you know is like you check for pulse, you check for his respiration. If these things are not there, probably the person has experienced a sudden cardiac arrest. Sometimes you see people just going on the roadside and they have excessive heat or dehydration, they fall down. That is just a syncope. In that case, you need not get panic and need not start CPR in those cases. So only when the person is not responding and he doesn't have a pulse or a respiration, you assume that he might be having a cardiac arrest. So immediate bystander CPR, that is cardiopulmonary resuscitation, it is to some extent effective in elevating the risk and improving his prognosis. So what happens when there is a sudden cardiac arrest, your blood supply to the brain gets stopped immediately. So the aim of CPR is to revive the heart and also to maintain the blood supply to the brain. So brain, how it will be, it is very sensitive to ischemia. Like even a brief period of reduced blood supply to the brain can cause a patient to go in for permanent coma. So the purpose of CPR is to maintain that blood circulation to the brain. So until a definitive measure has arrived. So when you see a person having a cardiac arrest, immediate thing you can do is to just give a CPR. Different types of CPR are there. One in which you do CPR, simultaneously give breaths also. there is CPR only, just to do compression, chest compression.
Okay.
No need for breaths also. That also is a good thing actually. So once a definitive treatment arrives, then probably he'll require further advanced cardiac life support measures. So as a bystander, your immediate job is to assess that he has cardiac arrest. Meanwhile, one person simultaneously has to call an ambulance or something so that he can be shifted to hospital. Another person can continue giving CPR until he receives some good operative, good hospital or a care is given.
అలాగే సడన్ కార్డియాక్ అరెస్ట్ తర్వాత ఎలాంటి జాగ్రత్తలు తీసుకోవాలి?
See, first of all, when you have sudden cardiac arrest, the probability of survival is quite low. If they say if like within 1 minute if your cardiac arrest is treated, probably that time also survival will be only about 25%.
Okay.
If and the duration of cardiac arrest is prolonged for 10 minutes, you see a person, he has cardiac arrest and 10 minutes have gone, the probability of survival is probably 0 for him. He may not survive. So that's the importance of time in cardiac arrest. So many times we experience cardiac arrest in our patients who are in hospital and they revive because immediate attention will be given. That doesn't happen to a person who has out of hospital cardiac arrest. Okay, so most of the time that golden period is lost, so such people won't recover. But once you recover from cardiac arrest, there is a lot of other things, like he'll not immediately start walking, so he requires a lot of care. That's called post cardiac arrest care. Okay, there are some other associations also which you develop, like as I told, after CPR person develops brain ischemia or hypoxia. So some patients, if the duration of CPR is less and he has revived early, they recover early, and the duration of CPR is long and he took long time to revive, then he will develop hypoxic encephalopathy or a permanent brain damage. So the cardiac arrest patients varies, like what is the prognosis depending on in which setting he got a cardiac arrest and how well he has been revived after cardiac arrest.
సో ఫుడ్లో కూడా ఎలాంటి జాగ్రత్తలు తీసుకోవాలి?
See, diet diet also is one of the risk factors for cardiac atherosclerosis, you can say, leading to blockages. So the blockages are basically your lipid deposits or cholesterol deposits. So a diet which is very high in saturated fats, high in processed meats or red meat, this will ultimately lead to cholesterol getting deposited in your blood vessels and you will end up in heart attack. Similarly, a diet which is very high in salt intake will increase your blood pressure, and again you will land up in heart attack and other things. Okay, a diet which is very high in sugary foods will obviously lead to diabetes. So diet control is very important when it comes to preventing your risk of heart attacks and also preventing the development of these risk factors.
Okay.
So a diet has to include a balanced diet which is rich in fruits, vegetables, nuts, and which is low in saturated fats, which is low in salt.
Okay.
So all these combined together may prevent the development of risk factors, and which in turn will lead to better cardiovascular health, you can say.
అంటే సార్ మెయిన్గా ఈ బీపీ షుగర్ ఈ కాలంలో చాలా మందికి వస్తుంది. సో ఈ ఉన్న వాళ్ళకి సడన్ కార్డియాక్ అరెస్ట్ కంపల్సరీ వస్తుంది అని ఏమైనా రూల్ ఉందా?
No, there is no such rule as such that these people compulsorily they will develop heart attack.
Okay.
We have seen many people with diabetes being 20 years, 30 years, but even then their heart status is very good. So it all depends on how well these risk factors are controlled.
Okay.
A person, we have seen young people as early as 30 years with uncontrolled sugars landing up in heart attack. We have seen persons with 60, 70 years with well controlled sugars not having any heart disease. So that all depends on how well is your control, how well you have controlled your sugar,
Okay.
how good is your diet, and whether you are doing regular physical activity, all these things. So like it is not that all patients with these diseases will develop heart attack. If you control your risk factors well, if you have a healthy diet, if you do regular physical activity, and you don't have any other habits like smoking, tobacco, chewing, then definitely the chances of heart problems is quite low in such people.
సార్ అలాగే సడన్ కార్డియాక్ అరెస్ట్కి ట్రీట్మెంట్స్ అలాగే చికిత్సలు ఏ విధంగా అందుబాటులో ఉన్నాయి?
Yeah, see, the treatment and all depends on what is the reason for your cardiac arrest. Suppose a young person experiences cardiac arrest and he has survived the cardiac arrest, so definitely we will come to identify one of the cause. If he has some disease which is affecting his heart muscle like HCM, in those patients also the most common reason for cardiac arrest will be an abnormal rhythm, as I told, that is called as ventricular tachycardia, those things. So to prevent those things, there is a device called as ICD, implantable cardioverter defibrillator. The device is implanted in the chest and it gives a shock to the heart whenever it detects an abnormal rhythm. So a young person who develops sudden cardiac arrest and has survived, and one of these causes is detected in this person, then an ICD is very effective in preventing sudden cardiac death. So in fact, this is the only recommended therapy apart from few drugs which will improve your survival in these type of patients. That is one. And when it comes to heart attacks causing sudden cardiac arrest, obviously all these measures which I already told has to be done, and once you develop a heart attack, that has to be treated. Once you develop a heart attack also, you don't waste time, go to the hospital, get treatment done. If your treatment is good, your heart pumping has improved after heart attack, then the chances of sudden cardiac arrest again recurring is quite low. So depending on the cause of cardiac arrest, different modalities of treatment are available. So always when you have a risk, get investigation done, and along with that therapy will be available depending on the cause.
సార్ అలాగే ఇప్పుడు మీరైతే హార్ట్ అటాక్ వచ్చినప్పుడు స్టంట్ వేస్తూ ఉంటారు, సో వాళ్ళకు కూడా ఈ సడన్ కార్డియాక్ అరెస్ట్ వచ్చే ఛాన్స్ ఉందంటారా?
Yeah. See, once you have a heart attack and you have undergone a therapy in the form of stent treatment, if you are taking regular medicines, if your risk factors are controlled, the chances of sudden cardiac arrest are less. But a person, stenting is not an end of therapy, you can say. It is just the beginning of therapy, you can say, because after stenting you have to be more control of your habits and your medications. Many times we have seen after stenting 2 to 3 months after stenting, a person feels totally fine and he will stop all the medicines, and again he will land up in heart attacks. Sudden cardiac arrest is possibility in such person. Okay, so but once you have put a stent and you are taking medicines, you are controlling risk factors, regular screening is there, chances are less. It is not 100% sure that you will not develop. You can develop still, because one vessel is blocked means some other vessel also can get blocked over a period of time. So but you have to do your what is recommended for you. If you do those things, the chances of developing sudden cardiac arrest is definitely low.
ఓకే అండి, థ్యాంక్ యూ అండి, చాలా చక్కగా వివరించారు సడన్ కార్డియాక్ అరెస్ట్ గురించి. ధన్యవాదాలు.
Thank you.
సో చూసారు కదండి, ఇది వాటి హెల్త్ కేర్ ప్రోగ్రామ్. మరొక అంశంతో మళ్ళీ కలుద్దాం.